The sacroiliac joint, or the SI joint, is the joint that connects the sacrum and the ilium, part of the hip. It's one of the strongest joints in the body. There are multiple ligamentous connections from the sacrum to the ilium, making it super strong. And so I'd like to talk about the SI joint as it relates to pain. So starting from the deepest layer of muscles of the spine, you have the multifidus. This runs the full length of the spine and attaches down at the sacrum. So you can even have pain near that SI joint due to muscle dysfunction, such as the multifidus and other ones, which I'll go through here. The next layer up is the longissimus, which is another muscle that runs the full length of the spine. This one attaches down near the sacrum as well, potentially giving you a feeling of SI joint related pain. Another layer up is the iliocostalis. So this attaches at the ilium of the hip bone, which is right near that SI joint as well, potentially confusing SI joint pain. And lastly, in the most superficial layer of muscles, three bigger muscles that can be confused for SI joint related pain are the lat, which attaches down on the sacrum, the gluteus maximus, which attaches on the outer hip bone there, and then the gluteus medius, which attaches on the inner hip bone. These are three big muscles that are often used for a variety of actions that can be confused for SI joint related pain due to the attachment sites of these muscles. So unless you are pregnant or dealing with some sort of hyperlaxity disorder such as Ehlers-Danlos syndrome, the SI joint is rarely affected in my opinion. Now there are certain instances where the SI joint may be affected, such as a traumatic injury, such as a motor vehicle crash. Potentially stepping off the curb in the wrong way can put a lot of force up through the femur and impact this joint. But rarely am I doing any sort of joint work for the SI joint, just because it's hard. You can't really mobilize the joint because the connective tissues of the ligaments are so strong. And so I'm rarely treating the SI joint itself, but rather muscles that attach near the SI